You know, in the United States right now, the status is that 1 out of 2 people are dying from heart attacks and strokes today. So it's no wonder that there's a huge concern. And if you're an individual who's concerned about inevitably or eventually or possibly having a heart attack or a stroke, I advise you to continue to watch this video, because what we want to do is to share with you some indicators that you can see that indicate you have a risk factor or you are at risk for having a heart attack or a stroke. Now, before I do that, if I were to ask you, just give me a risk factor that you think indicates a person having a heart attack or a stroke, and you said high cholesterol, I would say to you that you are wrong. It's not even in the top 10. As a matter of fact, and I'll share with you here, that elevated levels of triglycerides or insulin or cortisol or C-reactive protein are indeed indicators, risk indicators of potentially having a heart attack, but not cholesterol. That's the way you'd want to head. According to research that was done at the Framingham Heart Study, it indicated and showed unequivocally that 40 to 50% of the people that died of heart attack had cholesterol levels that were below 200. So again, it's not high cholesterol that killed 4 to 5 out of 10 people with a heart attack. And also I want to share with you, because there seems to be this passion today to drive down the cholesterol levels lower and lower and lower. Well, let me share with you this one tidbit of information as well. If you get your cholesterol level at 180 or below, you run 3 times the risk of having a stroke because of having your cholesterol at 180 or below. Think about that the next time your doctor wants to put you on a statin drug to lower your cholesterol. So, what are the real risk factors? I'm about to share those with you, and there's about 10 of them here that it would behoove you to take note of. Number 1, if you have cardiac arrhythmia, that means if your heart has atrial fib or it beats abnormally or whatever, it could be due to a number of things that could easily be resolved. It could be a result of a malfunctioning thyroid. It could be a result of you drinking water consistently out of plastic bottles. It could be a result of a low magnesium level in your body, all of which could easily be resolved and taken care of, and you on your merry way. Now, also another risk factor is elevated triglycerides. Elevated triglycerides, especially if there's an elevated ratio of triglycerides to HDL cholesterol. What's happening there is the triglycerides are what are actually hardening the walls of the arteries. So if you lower the triglycerides, you don't have to worry about an impending heart attack. Also, elevated homocysteine. Extremely high homocysteine levels were 3 times more likely. Individuals who had that were 3 times more likely to have a heart attack than individuals with normal or lower homocysteine levels, especially in men. Now, also another one is elevated insulin. So what we're saying to you, if you've been diagnosed with type 2 diabetes and you're struggling with insulin levels that are erratic, then the bad news is that you are at a very high risk of having a heart attack. So that's something that you want to discuss with your doctor, getting your blood sugar corrected and the insulin levels lowered. Also, high cortisol levels, another hormone there. It's associated with hypertension if you have high blood pressure, which increases your cardiovascular risk. And, you know, if your blood pressure is high and your cortisol levels are high, you don't want to suppress it with a drug. What you want to do is find out what's causing your heart to express itself within high blood pressure. So again, don't deal with just the effect, or while you're dealing with the effect, have your doctor find out and identify what the cause is, so you don't have to continue to go down that road. Also, elevated hormones, while we're talking about hormones, elevated estrogen in respect to progesterone. That mostly has to do with women. Now, I know a lot of you that have been told that, you know, you're looking at your estrogen levels because of breast cancer, reproductive cancers. But look, if your level, even if it's not alarmingly high, if the ratio is in respect to your progesterone, the estrogen is higher in respect to your progesterone level, then indeed you are at a risk of having a heart attack. And unfortunately, women now are equal to and even passing the male gender in the rate of heart attacks now. Unbelievable. Now, also, as we're talking about hormones, now in men, if you have a low testosterone level, then you have a much higher risk of having a heart attack when the testosterone level continues to lessen and lessen and lower and lower. And then the opposite is true in women. We get back to the testosterone. If you have a high testosterone level as a female, then you are a candidate running risk at having a heart attack. Also, the lipid peroxide. Those are the free radicals that actually damage the cells, or damage, yes, the cells and the arterial walls as well. And they're associated when you have high lipid peroxides. You are at risk not only for the heart attacks, but for cancer, for strokes, and actually early aging. So, you know, you can be a 40-year-old female, but you look like you're 60 years old because the cellular degradation. The cells are dying very quickly, they're aging quickly, and that's what's going on. And probably the most famous of the 10 here is the elevated C-reactive protein, because that's showing you that there's a tremendous inflammatory response that's going on in your heart. It very well could be because you have low CoQ10 levels that's causing your LDL to oxidize and drill holes in the arterial walls, which is resulting in a tremendous inflammatory response. And it's showing up now as a high or increased level of C-reactive protein. Look, there's other things too. You can have a thyroid insufficiency. I mentioned earlier a magnesium deficiency, or you can have a fatty acid imbalance. And this is why we do what we do in our center with the blood work that we do for our patients. Because we're not just looking at symptoms, we want to see why they have those symptoms. What's causing the high blood pressure? What's causing the C-reactive protein to be so high? What's causing the imbalance of the estrogen and the progesterone that's resulting now in an increased risk? Because, you know, a lot of people, they think they're only focused on one thing, when in fact there's a monster that's being created, you know, in the behind the curtain, so to speak. So again, have this talk with your doctor that's treating you. See if he or she does the blood work that can identify these risk factors now that you know what they are. And if they don't, you're welcome to contact us, because this is what we do for our patients here. I hope this information has been helpful to you, and indeed I believe it will be if you act upon it, if you do something about it, because remember, your health is your responsibility. Again, if you want some assistance in achieving that, that's what we do. You contact us, because we're here to help. So until the next video, and as always, God bless.